Welcome to Twin Take Tuesdays. Your patient is 85 years old and has all kinds of medical comorbidities, hypertension, diabetes, hyperlipidemia, on Plavix, and they come in septic and have some multi-system organ dysfunction. Do you take him to the operating room or do you place a cholecystostomy tube? Let's debate. I'm operating. Age alone isn't a contraindication to surgery. I had a patient the other day who had an external fixator on and she was 100. The gallbladder is the problem. So let's fix the problem. Surviving sepsis guidelines say, let's get source control. So let's take her to surgery. Cholecystostomy tubes can clog, they can dislodge, they get infected, they lead to recurrent hospitalizations. Many elderly patients actually tolerate surgery and general anesthesia pretty well, and they don't tolerate sepsis turning into septic shock. If they can physiologically withstand anesthesia, definite source control, I think, is the best. Okay, not so fast. This is not about chronological age. We've talked about this before in grand rounds and on rounds in the hospital. It's not about how old they are, like on their birth certificate. It's truly about physiologic age. If my patient is septic, frail, vasopressor dependent, severe cardiopulmonary disease, surgery really might be the bigger risk in this patient. So a Perc Chole Tube can rapidly control and get what you were saying, source control in septic shock, while avoiding general anesthesia and an operation. Some people just simply need time to recover before we put them under general anesthesia. So sometimes the safest option really is no operation, at least not today. Patients with tubes frequently come back to the hospital. Yes, but dead patients don't come back. Definitive treatment matters. Survival matters. Most patients can handle laparoscopic or minimally invasive cholecystectomy. Not all septic octogenarians are created equal. I think ultimately the answer isn't age. The answer is physiology. Can they survive it without surgery? Good surgeons certainly know how to operate. Great surgeons know when to operate and when not to.